How do we keep Omicron at bay? With Omicron spreading rapidly across the world, Bangladesh is bracing itself for the battle against a potential third wave of the pandemic. The health ministry has already addressed that the country is preferred to fight the new variants. Other health authorities had issued a set of 15 soon to be enforced guidelines coronavirus screening at endpoints in the country. Testing, quarantine, vaccinations, and public movements and gatherings. Meanwhile, according to media reports, the government has also been able to partly reinforce healthcare infrastructures to better handle the new wave, increasing the number of intensive care units and high dependency units dedicated for COVID 19 patients. In addition, more than 1,000 ventilators have been provided to hospitals at Upazila level, and more than 130 hospitals equipped with a central oxygen system. Abul Bashir Mahmoud Khurshid Alam, the DG of the Director General of Health and Services, has been quoted as saying that oxygen generators are being installed on around 40 hospitals across the country. The company is working on installing more oxygen generators to support rising COVID caseloads. However, the authorities must not lose sight of the fact, in the face of the full-fledged outbreak of new wave, these reinforcement measures might not be sufficient. Over the last few weeks, there has been a noticeable spike in COVID 19 cases, with more Omicron patients being identified every day. Only Monday morning, January 10, the country recorded as a 8.53% COVID patient rate, with 200 231 day new cases registered, a jump from 6.7% recorded on Sunday morning. Health experts fear further rise in the cases in a minute. All the new measures being taken point to the farsightedness of the health authorities, including the National Technical Advisory Committee, NTAC, on COVID 19, DGHS, and other related bodies. The effectiveness will depend on how all they are enforced. In the past, we have seen people escaping quarantine from hotels, public transport, running over capacity despite restrictions, people grossly plotting social distancing guidelines, roaming around and enjoying long weekends even during lockdowns, including misuse of the movement pass, introduced to control public governments. Uh, Crowding restaurants, shopping malls, kitchens, markets, and other public spaces, often without wearing masks. The list goes on. Even while many countries, including our next door neighboring India, is struggling in the face of COVID 19 cases, the people here could not help but celebrate the new era of Christmas. Then there are those grand winter weddings that come with about half a dozen side events. Where hundreds, if not thousands, gather to bless the brides and grooms. There are also the weekend parties with family and friends. These occasions provide the perfect breeding grounds for the COVID 19 virus. Unfortunately, this can only be contained with state imposed curves. For the governments, managing the crowds at airports is another sticking point which has emerged as a major concern in the recent weeks, with international flights being suspended for 8 hours every day at the Dhaka airport due to ongoing construction work for the third terminal. The airport authorities are under increasing pressure to accommodate the cramped flight schedules. It is only natural that the health desks and testing counters would be crowded too, and there should be strict enforcement of social distancing and testing guidelines for health for both inbound and outbound passengers to ensure their safety. It is understandable that blanket curves on public movement, including lockdown, are an extreme measures with profound implications for countless people. Nonetheless, in our cases, it would be worthwhile to consider the possibility of such measures in the long run, especially considering that many nations are having to resort to this to contain the new wave. India, for instance, curfews have been imposed in Delhi and Mumbai and other states, including West Bengal and Karnataka, have had to impose various other restrictive measures and weekend curfews to cope with the rapid increase in COVID cases. In view of the current scenario, the government in Bangladesh should consider planning ahead for worst case scenarios, including by determining the surge scope of stimulus packages, support mechanism, and related logistics for those who would be most affected, especially small businesses, underprivileged segments. This will help reduce public sufferance and the likely economic backlash. Pre planned measures are usually better implemented. And in the context of the fast changing COVID landscape, one cannot be too careful. Omicron is highly contagious, but comparatively less severe than other variants with low hospitalization rates. Therefore, it might not be as demanding on our healthcare infrastructure as the Alpha or Delta variants. But the danger is still perceived, and with the virus mutating constantly, we cannot risk becoming complacent. We need to be on our guard at all times so that we can anticipate the new challenges and minimize the damages of the new wave. The new sales of 15 guidelines also needed to be enforced at the earliest. The general public must also take ownerships of the responsibility and do their part to keep COVID-19 at bay. The Bangladesh government alone is not responsible for fighting the pandemic. It is the responsibility of each and every single citizen of this country. No matter how clicked it sounds, we are in this together. We can only flatten the curve if we put a united front. The content created is Tasneem Dev, is a columnist.